We are living in extraordinary times with extraordinary challenges. You all play a pivotal role as we are responding to this COVID-19 pandemic. And I know that many of you, from speaking with you directly, from emergency departments to critical care, to public health and infection prevention and control, to workplace health, and many others, that everybody's working together and doing their best to do what we can for ourselves as well as each other and our patients.
I don't know if any past experience could have prepared any of us for COVID-19. It's a novel virus, and while it is related to the SARS and the MERS viruses that came before it, it in many ways behaves quite differently. The only experience that I've had that I think partially prepared me for COVID-19 was the H1N1 swine flu pandemic in 2009.
You know, if I look back at the last 5 weeks, it's been lots of ups and downs. Sometimes I feel exhausted. Sometimes I feel empowered. Sometimes I feel like excited, ready to do this. And next thing you know, we're kind of down in a lull and up in a big lull. So lots of roller coaster emotions, I'd say, almost daily.
This has been the most challenging event of my career. I'm a relatively new nurse, but I have some decent communicable disease background. There were many challenges in the beginning, and there continue to be challenges. We're all just trying to do the best with what we have at that moment and being kind to one another and being mindful that we're all going through something very similar, and we'll see each other on the other side, I guess.
I think what's really important, again, is just, realizing that we got here because of a team effort. There's so many people involved at all levels of the system, whether it's in the hospital system, the community, society in general. And I think appreciating that, that sort of, be kind, be thoughtful kind of energy, because there are things, we all have plans as how to get through this, but there's going to be bumps along the way in the next phase, and we have to, make sure we maintain that kind of posture of, we're in this together. It's a team effort. It's going to take some kindness and some cooperation that is beyond the norm to make it happen.
Our we culture, it's very important for us to work together as one. It doesn't matter whether you're working in one department or another, or one hospital to another, whether you're a contracted housekeeper or whether you're from another health authority. We are all in this together.
Success right now looks like just managing well in the hospital, keeping our numbers as low as we can, continuing to work really well as a team. We've really seen a dynamic unit of all different healthcare professionals working together, doing a lot of teamwork, which helps lighten the load on everybody.
Success for me at this time of pandemic is having the courage to continue, to keep going on and continue the fight against COVID. To me, that's my definition of success for this time.
We're actually very blessed to have everybody around us, whether it's the community, the management, the staff within the department, and everybody else that's coming through the door thanking us every time. So, you know what? Let's all stay home and stay safe.
I'd like to thank the whole Fraser Health family. There's nearly 30,000 of us. That includes staff, medical staff, and leaders in the organization that have gone above and beyond to ensure that we prepared for the pandemic, delivered an extraordinary response, and now working very hard to develop recovery plans. I think everybody has been working together to demonstrate our we culture how we work as teams across the whole region, how we are connected to each other, as well as how we partner and how we come up with new solutions for our patients and families and communities. I'm also grateful to our partners such as our foundations, generous donors in the community, and all of our communities who have really ensure that they're doing their part in flattening the curve and adhering to the public health measures and directives, which have been difficult, as well as sacrificing not seeing some of the loved ones on site as they're going through difficult health journeys, as well as postponing elective surgeries. I love to thank everyone that's gone through all of this experience together, and I think we're well positioned as the whole organization to stand together stronger after this experience.